Hi, and welcome to this installment of Frank and Mary here in Southborough. If you haven't seen this show before, my name is Art Bergeron. My day job, I do elder law at Myrick O'Connell up the street in Westborough. But this is not about my day job, it's about my friends Frank and Mary. If you have seen any of my presentations at the Senior Center, you know that my friends Frank and Mary's goal in life is very simple. They want to live in their house until they die and be buried in the backyard. And if that's Southborough, that means right here. They don't want to move. And so I've got this great co-host, Doug Peck, who always finds these great people that we can talk to help you, if you kind of identify with Frank and Mary, know how you can continue to stay in Southborough. Although I remember meeting this woman that we've got today because we had her on last year at about the same time to talk about the same thing, which is really important. Doug, whom do we have today?
Yes, good morning, everybody. We have Carolyn MacLeod today. She is the Shine Counselor for Southborough, and she's been doing it for quite a few years now, Carolyn?
10.
10 years,
10.
That's a long time. Shine Counselors are volunteer positions. They work very hard. They go through training on a monthly basis, but I'm going to introduce her and let her tell you what a Shine Counselor does and why you should make an appointment, because we are still very active in doing this.
And Doug, before she does that, I want to insert, this is the greatest Shine Counselor I've ever met. I've met a lot. I do a lot of this work. It's unbelievable. I want to talk to her about my Medicare plan. So,
okay. Well, with that introduction, Carol. So what does a Shine Counselor do?
So I actually do two things. I do Medicare and Medicaid counseling, which in Massachusetts is Mass Health.
Mm-hmm.
So I screen people to see if they're eligible for any of the Mass Health programs.
Oh, good.
But currently, we're right in the middle of open enrollment, which is when people can switch their Medicare plans. And it ends December 7th. And this year's challenge.
You're fading out a little bit.
You're fading out.
All right.
That's better.
Okay.
Right. Okay.
All right. So, so this year I've had to do it remotely, and I'm actually doing it all over the phone. Originally, the idea was a combination of Zoom and phone, but I discovered that my computer at work doesn't have a camera or audio capability. So we're doing it via phone, and it's actually going better than I expected. I have the majority of the people so far are people I've had before. So they know me, they trust me, but I am starting now to get some new clients.
Mm-hmm.
But I wanted to talk specifically today about two big things that have come on the horizon that I didn't know about until just before open enrollment started. The first one is good news.
Good.
And that is the Center for Medicare Services has instituted a pilot program for people on insulin. It's called the Senior Savings Plan, and 9 of the drug plans and 2 of the Medicare Advantage plans are participating in this Senior Savings Plan. And what it means is that if you're on insulin, so most of the insulins are covered, it's only $35 a month for your insulin. And typically I'm seeing people on insulin and saving them over $5,000 to switch them to one of these plans.
Wow.
So that's huge.
Yes.
That's huge. And I'm concerned that there's people out there on insulin that have been struggling and unaware that this new pilot program is now in existence. So hopefully this cable Zoom meeting will get the news out there. Do either one of you have any questions about that specific plan?
No, but you have to sign up for it, I take it. I mean,
You have to.
In the right Medicare Advantage plan.
You have
or your D plan. So you're telling me that both the drug, if you're doing either one, if you're doing a D or if you're an Advantage plan, and you're an insulin user, you want to know about this to see if
Yes,
your plan
yes.
has got it. Yeah.
Yes,
Yeah.
it's more likely that it's easier to switch a D plan to one that's in this program. It's harder to do a Medicare Advantage plan switch because you want to make sure your doctors take it.
Mhm.
But nevertheless, it's out there. The two Medicare Advantage plans participating are United Healthcare and Harvard Pilgrim. And then all of the drug plans have at least one of their, all of the drug companies have at least one of their drug plans in this program.
Oh, good.
So it's good. It's good. And the other thing that came up that I'm particularly concerned about is Raytheon retirees. They used to have, Raytheon used to had plans that covered like a supplement and drugs. And a couple of years ago, they had their retirees get their own Part D drug plans, but Raytheon supplemented the drug costs. Starting in 2021, Raytheon's not doing that anymore.
No.
There's no subsidy for drugs for their retirees. I had a couple on Thursday and switched both their plans and saved them $11,000.
Wow. That's why you got to go see somebody like Carolyn.
Yes.
The money that you can save, if you know what you're doing, is phenomenal. That's a huge amount of money.
Well, I'm particularly concerned about Raytheon retirees. If they didn't read the letter or understand the letter, and their drug plan's been fine, they may decide not to do anything, and then they'll go to the pharmacy in January and get the shock of their lives. So,
now, Carol, this relates to something you said earlier on, that you know, many of the people that you see are people you've seen before, and now you're getting some new ones. But can you just kind of deal with that issue? The reason why you really want to be looking at this over again every year, that it's just so important to look at your plan every year. Can you just kind of speak to that a little bit?
well, particularly for people that have supplements and standalone Part D plans, the Part D drug plans are the ones that change the most annually. They drop coverage for some drugs completely, and they also move things around in tiers. Drug plans have what they call formularies that show the drugs they cover, and their drugs are in tiers. There's 5 tiers, and the cost goes up as you go up higher in the tiers. And so you could be taking a drug one year that's in a tier 3, which is fairly manageable financially, and have it move to a 4 or 5 tier, and then be struggling to pay for it. The Medicare Advantage plans are the most steady eddies, and they don't seem to have, people that have drugs and Medicare Advantage plans don't seem to have that much trouble. However, I have a whole class of people that had a Blue Cross Blue Shield PPO, which was very attractive because the in-network and the out-of-network co-pays were identical. That's not true for 2021. Some of their co-pays have gone to percentages, and I never want to see somebody in an out-of-network situation where they're paying a percentage of a cost.
Right.
You don't even know ahead of time what the cost is.
Yeah.
So that's the biggest issue this year, is that Blue Cross Blue Shield PPO, because last year it was very attractive to have same cost in and out of network, but that's not true this year.
Well, so I have 2 quick questions for, if you don't mind. One is, how do people set up an appointment with you, number 1, and what information do they need to bring or get to you? Because that's important, right?
Right. So they call the senior center, and currently, because it's closed, the receptionist is here on Monday and Wednesdays. But they can call and leave their name and phone number, and she'll call them back. She sets up all my appointments for me.
Okay.
And then she sends out, this year, she's sending out 2 documents. One is a fill in your Medicare number, your drug plans, and your medications. And the other one is a mymedicare.gov document. The CMS decided last year that everybody that wanted to have their plans checked had to have a mymedicare.gov account.
Okay.
And it has created a lot of problems.
Yeah.
I had to set up a lot of people last year, and I gave them a little card with their username and password on it. Of course, you know what happened with that. They've lost them, or they misunderstand how to get in. And the third, if you try 3 times to get into the system, it locks you out. And so that's been my sort of a pain in the neck this year. Is you used to be able to put in somebody's Medicare number, their name, their date of birth, and their effective date of Part A, and you could get into the system and help them compare. Now you have to go into the mymedicare.gov account, their personal accounts, and it's been problematic.
Wow.
It's been problematic. But it's all aimed for people younger, seniors. You can do it on your iPhone.
Oh.
The majority of my seniors don't even have computers.
Yeah.
So
Yeah.
the thought of telling them to use an iPhone to get into their My Medicare accounts,
Yeah.
it's beyond challenging.
That's crazy.
But, yeah. I mean,
So can you talk a little bit about prescription advantage? You know, for folks.
So prescription advantage.
The reason why I say that is many people, you know, they'll confuse it with Medicare Advantage, you know, and they'll say, well, that has nothing to do with me, you know, but it can be a big deal. You know, I'm amazed by how many people are unaware of the benefit. You know?
It is one of the best mass health programs out there. It's free. It doesn't count your assets. It only counts your income. And if you qualify income-wise, it's designed, it has 2 perks. One, if you fall into the dreaded Medicare donut hole, it helps you in the donut hole. And it cuts your drug costs considerably. The other advantage it has is it gives you a one-time special enrollment period during the year outside of open enrollment with Medicare. So if, for instance, you forgot to pay your drug plan premium and you lost your drug coverage, if you had prescription advantage, I can re-enroll you in a new plan, or even put you back in your existing plan anytime during the year. But primarily the donut hole is huge. It's huge. For some people, their drug costs drop by 90%.
Wow.
Prescription advantage. You get a card with a member number, and you take it to your drugstore as if you would your drug plan, and it works silently behind the scenes. It wraps around your drug plan, and it tracks your drug costs, how much you're paying, and your retail costs of your drugs. And when you hit the donut hole, it kicks in automatically, which is really nice.
Yeah, it is
a gigantic thing. And, you know, I guess I didn't, until I was getting ready for this presentation, and I know Carolyn and I had talked to you about the fact that I actually did a seminar which is running in a number of communities, the theme of which is don't listen to me, right? Here's a way of thinking about this. Call Carolyn MacLeod. And you're actually but it was only in the course of that I came to appreciate, you know, one of the problems with the donut hole, and I know, I don't even know the magic number, the number, the number, the amount of your drug costs at which the donut hole starts, but that the calculation regarding when it starts is not based on what you've been paying, but based on the total cost of the drug. So you may have no idea, because your copays are very low, right?
Yes.
That the actual cost of your drug is so high that in the middle of the year, you're going to hit the donut hole, at which point all of a sudden your copays go crazy, you know?
Yes, yes. The other issue besides prescription advantage is the deductibles that drug plans have. Practically every Part D drug plan has a deductible, and the average is $445. So you could be taking a generic drug and have zero copay. And then something happens in the middle of the year, and doctor doctor gives you a script for an expensive drug, and normally you would expect, oh, it's just going to be a low copay, but you get subject to the deductible, and you're like, what happened? I'm paying $445 for this drug. I don't understand it.
Mhm.
So what I try to do, even with people that have low premiums and low drug costs, to be aware that that deductible is sitting there. And in some cases, it doesn't kick in until you take a drug in tier 3 or higher, but it's sitting there.
I see. But once again, that would be in the fine print. This notion of a deductible that only pops up if you're in a particular tiered drug, right?
Yes. Well,
So-
when people come see me, I let them know if there's a deductible. And I also let them know what tiers it affects. A lot of them, it goes across all 5 tiers. Some of them, tier 1 and 2 are excluded, and some are tier 1, 2, and 3 are excluded. But it's all over the place. So, and I'm not really sure anybody going into the plan finder on their own would know that. There's all kinds of little glitches in the plan finder that the average bear wouldn't know. It's sort of like garbage in, garbage out.
Yeah.
There's if you put in your drugs for every 2 months, for some reason or other, that's not working this year. So you can't, if you take something every 2 months, you got to figure out some other way to put it in the system.
Come on.
Yeah.
And the other interesting thing is preferred pharmacies. If you pick a drug plan and you don't go to the preferred pharmacy for that plan, you could pay even thousands of dollars more than you should.
Wow.
So that's the other thing that I work with people, is making sure they understand which pharmacy to go to.
And I remember you're saying that, you can literally have, like a CVS on one side of the street and a Walgreens on the other. And for drug A, if you're at the CVS, you're paying twice as much as if you go to the Walgreens. For drug B, if you're at the Walgreens, you're paying twice as much as if you go to the CVS. So it has nothing to, there's no rational piece to this. This is totally about whatever the deals were that the drug companies had cut with the various pharmacies.
Yes.
And there's no way to predict, you may be having to go, across the street a lot, right?
Well, no, it doesn't work quite that way. If you have a drug plan that preferred pharmacy is Walgreens, it's Walgreens for all the drugs.
For everything.
But if you go to CVS by mistake, and you should be going to Walgreens or vice versa. So when I do searches, I put in the big players, the big pharmacy players, so that we can figure out what drugstore works. So.
And Carolyn, has it been your experience that the big players tend to really have, much better drug numbers because they're preferred pharmacies? Or is that just a kind of a myth?
See this thumb here? The answer is yes.
Yes.
The answer is yes.
How about mail order for some of those drugs?
So when I first started this, mail order was a bargain. And I would always look at the mail order costs and talk to people about whether they could manage mail order. It's not true anymore.
No.
It's rarely true that mail order is a savings. And you know why? See if you can get. They want you to go into the store to get your medications, because what do you do when you go?
Buy other
things.
things.
This, you pick up that. And so rarely, the Humana Walmart plan used to have an amazing mail order, and now it's not a deal anymore because they want you to go in and use the Walmart pharmacy and go into Walmart.
Yeah.
And shop. So. Yeah.
So what happens if somebody, doesn't pick a plan before the 7th of December? Do they roll over into their current plan? Okay.
Their existing plan just continues.
Okay.
It's on automatic pilot. If, however, they do pick a new plan, a new Part D plan, it automatically overrides their existing plan January 1st. So they don't have to do anything. They don't have to call their
Okay.
old company and say, I'm not going to use you anymore. It happens automatically,
Oh,
which
that's
is
good.
nice.
Yeah,
It's nice. Yeah.
So
Yeah.
Carolyn, you had also, I remember when we were talking, you also talked about, not in all cases, but in many cases, the way in which you should think about whether to look at a Medicare Advantage plan, whether Medicare A and B in general is going to be better for you versus depending on your level of health need, whether an Advantage plan might work best. Could you just talk for a few minutes about that? Because I know people tend to focus on just the drug plans at the end of the year, right?
Yes.
And don't realize that they really should be kind of weighing at some point the Medicare Advantage plans versus the traditional Medicare A and B.
So I talk to people when they first come see me, and I say, if you're a healthy senior, I used to say young healthy seniors, but I don't say that anymore because there's a lot of healthy seniors that are in their 80s. So if you're a healthy senior and you don't go to the doctors very often, you go a couple of times a year with you got a strep throat or a hangnail or something, the Medicare Advantage plans are a really good choice for you. The monthly premiums are lower, and there are co-pays with every single thing you do, but if you don't do much, you don't generate a lot of co-pays. The standard supplement, which is on the other side, costs you about $200 a month. You can get a Medicare Advantage plan for $0. You can get one for $40, $50. You can get one for $100. Plus the Medicare.
So that's a big difference. That's like a couple $1,000s a year. Do the math. That's like a couple $1,000s a year in difference. Yeah.
Yes. And the Medicare Advantage plans have something the supplements don't. They have a lot of very attractive bells and whistles. They do, the annual eye exam is free. That's not true with the supplements. You get money off on eyeglasses. There's bigger and bigger hearing aid supplements. There's now some major dental packages in the Medicare Advantage. They do a lot of telemed conferencing. Some of them provide transportation. One of my concerns, though, is if you watch TV, it looks like you can get everything for free, right?
Yeah.
It's zero premium, zero copays.
Right.
You can get zero premiums, but the zero copays are usually associated with people that have some kind of Medicaid program that supplements it. So the supplement, the people that pick the supplements are people that want to go to any doctor they want to go to. The Medicare Advantage plans are networks. You have to stay within the networks with referrals for most of them. And you want to make sure you pick a plan that your primary care physician takes. That's one of the concerns I have about people that call on the phone to the TV ads. Those people are not checking to see if their primary care physician is taking the plan they want to sell them.
Yeah.
Nor, I had a friend in Florida that called up on a Humana plan that was zero premium. They never even asked him what medications he was taking to see if the Medicare Advantage plans carried his medications.
Yeah.
So you have to be careful when you call those numbers, those 800 numbers on the television. But supplements are for people that want to go to any doctor they want to go to. They don't want to have referrals, and they have a lot of underlying medical conditions where they go often to the doctors. You have diabetes, COPD, you have chronic lung disease, all those kinds of things. The Medicare Advantage, I have a fellow just the other day, and he generated $3,200 worth of copays last year.
Wow.
And I said to him, you need to come back. I had to make a new appointment, and I said, come back and we'll talk about, you probably need to switch to the other side of the chart and pick a supplement, because you're costing yourself money by staying with a Medicare Advantage plan. But I mean, I have a Medicare Advantage plan. It's part of my retiree package. I've always had it. I like it. My doctors take it. I've had a couple of minor surgeries. I've never been disappointed with the referral to the surgeons.
Mhm.
So a Medicare Advantage plan works well for me right now. So,
But that could change over time. But that could change
Yes, it could.
depending on your medical condition.
Yeah.
yes.
So Doug, you can see why I tell these people you just got to talk to her.
Yes,
Right?
yes.
This has been great.
Yeah.
This has just been great. Carolyn, we can't thank you enough for doing this again.
Well, it's a pleasure. It's a
And
pleasure.
Doug, you're the person that introduced me to Carolyn Ream, one of the many people that you opened up my life to another wonderful asset.
Well, one last comment for me is, you can't put this off. The 7th is right around the corner. If you're going to make a change, or if you want to know if you should make a change, call the senior center right away. Carolyn's really honestly booking up fast. So you've got to do it right away so you can get in. You may save yourself a considerable amount of money, and you just be doing the right thing for yourself. You just know if you're in the right plan, getting the right type of treatment. So important.
So
Especially people on insulin and people and Raytheon retirees,
Raytheon.
please.
We have thousands of Raytheon retirees in
a
Massachusetts.
lot.
Thousands.
A lot.
Yeah.
So Carolyn, thank you very much for this. This was just terrific,
Yeah.
right? So once again, we're going to book you on your schedule next year. You're going to be back
Yes.
too.
All right.
Doug, thanks again for doing
You're
this
welcome.
and for finding all these great people. We really appreciate it. Folks, this is a big deal. This is a
Yeah.
big deal. It's a lot of money. Don't try to figure this out on your own. I
Right.
mean, it's just silly.
Yeah.
Talk to somebody who's really following this stuff, right? And that's like her, right?
Yeah.
So
Okay.
thank you very, very much for watching. And we'll look forward to seeing you on the next installment of Frank and Mary here in Southborough. Thank you.
Bye, everybody.
Bye, guys.